Now we will talk about pulpotomy and pulpactomy. Starting with the pulpotomy, it is the removal of the coronal portion of the crown pulp chamber, and it is usually made to patients that are suffering from pain of their teeth. And this pain is not, and inflammation is not extending to the pulp after the pulp chamber, and it does not include not the coronal pulp. So we have a radicular and coronal pulp, and if the coronal pulp is inflamed and the radicular pulp is not necrotic and not intact, therefore we usually do a pulpotomy. But if the coronal pulp is inflamed and necrotic plus the radicular pulp, then we should use the pulpoctomy treatment. The pulpoctomy is a very simple procedure and can be finished within one visit. It requires the removal of the necrotic tissue of the coronal pulp, then applying a cotton pellet containing a formocresol. Formocresol is a liquid that is used to treat and clean the necrotic debris. We apply the formocresol for 5 minutes. Afterward, we clean and remove the formocresol, clean the cavity, and prepare it for the insertion of the restorative filling material. And the restorative filling material, it could be applied immediately, or it can be used and applied in the second visit. So if the teeth involved in pulpotomy is molar tooth, deciduous or permanent, then we use a pulpotic. A pulpotic is a mixture of three liquids and powders that it requires 7 hours of setting. And after we apply the pulpotic, we give the pediatric patient time so that he visits us the second time and we can apply the temporary filling. Sometimes it is GIC and covered with non-staining, or it could be covered with amalgam restoration or other type of restorations. When it comes to pulpoctomy, we have partial and complete pulpactomy. In partial pulpactomy, we do not extend to the apical foramen or the apical constriction of the radicular pulp. And we, after cleaning with a headstrom and with a barbed approach, files, and other instruments with irrigation, just as the usual endodontic procedure. Then we apply the suitable materials for the partial pulpectomy, and it sometimes it does not have to be in pediatric patients. Gutta percha, and it is only required for some types of obturating materials such as cement, zinc oxide, eugenol, or other MTA or calcium hydroxide are also used to maintain the tooth for a longer period of time. When it comes to complete pulpectomy, we go behind or beyond the apical foramina in order to get rid of the periapical lesions and make a drainage of the tooth. And this was the brief or small introduction and summarize of the lecture of pulpotomy, pulpectomy, and partial and complete pulpectomy.